Did you know that trigeminal neuralgia is one of the worst pains known to mankind? The pain can be so intense that it has the potential to destroy the life of the sufferer. Imagine living with 1,000 electric shocks on one side of your face. These appear when you talk or eat or even touch your face. Living with trigeminal neuralgia means constantly dealing with sharp, stabbing pains in your face, which can be triggered by everyday activities like eating, talking, or even brushing your teeth. These pain episodes can be so intense that they disrupt your daily life, making it difficult to work, socialize, or enjoy simple pleasures. People with trigeminal neuralgia often have to develop coping strategies just to get through the day. Many have to rely on medication to manage their symptoms, which can have side effects and may not always be effective. Hello and namaste. I'm Dr. Malathi Panchwagh. I'm an anesthesiologist and a perioperative physician at the MVD Center here in Pune. The unpredictability of trigeminal neuralgia is one of its most challenging aspects. You never know when a pain episode will strike, and this constant uncertainty can be stressful and anxiety-provoking. Simple tasks like going for a walk or meeting friends can become daunting experiences as you're always on the edge and you're apprehensive about the next pain attack. Trigeminal neuralgia is a type of face pain which feels like electric current coursing through either your eye or your cheek or your jaw. Some patients also describe it as 1,000 sharp needles pricking at the same time, or a blade slashing through the eye or the gums, or like spicy chili powder being rubbed on your face. This pain lasts for a few seconds to a few minutes and comes a few times a day. The pain is usually triggered by eating or talking or brushing the teeth or applying makeup or shaving the face. Even washing the face, showering, or when a breeze touches the face can also trigger the pain. This pain is initially mistaken as dental pain or eye pain or even pain deep inside the ear, and the patient seeks help from a dentist or an ophthalmologist or an ENT surgeon. Eventually, they realize that the pain is different and it has triggering factors. When they eventually go to a neurologist, they are put on medication which helps control the pain. Initially, the pain is not very intense, not very frequent, and therefore it responds to smaller doses of the medication. Pain management is a major concern for individuals who live with trigeminal neuralgia. They often have to work with their doctors to find the right combination of medications and therapies to alleviate their symptoms. This can be a trial and error process, and it may take some time to find what works best for each person. As the disease progresses, the pain becomes worse and doses have to be increased. There comes a point when the higher doses also do not effectively control the pain and the patient is miserable because of it. One must remember that medications for trigeminal neuralgia cannot cure the disease. They only control the pain. The patient now has several problems: the pain, the side effects of the medication, and the fear of the pain attack coming. During this journey of being diagnosed as having trigeminal neuralgia and understanding the triggers, understanding our own body and the pain and how we respond to it, the patient slowly learns to alter their lifestyle to accommodate the pain and the medication. And it's not just the patient. The entire family also has to do this. The life of the entire family revolves around the patient's pain. While it is sometimes possible to avoid triggers, it's not always practical. Like brushing teeth, washing face, eating or talking, these cannot be avoided. Non-surgical alternatives to medication are available, but they are not satisfactory in terms of efficacy and duration of pain relief. Living with trigeminal neuralgia requires a great deal of courage, patience, and perseverance. However, with the right treatment, support, and mindset, it is possible to improve your quality of life and find ways to manage your symptoms. By sharing their insights and experiences, individuals who are suffering with trigeminal neuralgia or have suffered previously with trigeminal neuralgia can help others who face similar challenges. This is the reason that we encourage patients to join our support groups and help each other. Because there is a mechanical compression on the trigeminal nerve that causes the neuralgia, surgery is a most logical and effective treatment in many cases. The surgery is called microvascular decompression. This is done under general anesthesia and requires hospitalization for a few days. As a surgeon, it is the most satisfying moment when patient wakes up from anesthesia and immediately puts a hand on their face to check if the pain has disappeared. We cherish the looks of happiness on their faces, which happens nearly every time, and this is what motivates us as a team which deals with trigeminal neuralgia. So in conclusion, I would say that while living with trigeminal neuralgia is challenging, we would encourage each and every patient to remember that there is a possibility of long-term pain relief and that they must explore the possibility of getting surgery done. Have you got any interesting symptom to share with us? Do comment and let us know, or call us on our helpline if you want to know more about the trigeminal neuralgia surgery. I would also encourage you to visit the trigeminal neuralgia playlist on our channel, which has nearly 100 videos. Some are educational, some are surgical, some are lectures for doctors, and some others are patient experiences. Do check out these videos and see what interests you. Do let us know if you have any particular questions regarding this debilitating disease that you want answered or you want videos to be made of to get more insight about this. Thank you very much. Your likes and your subscriptions motivate us to make more videos which are helpful for many of the patients who suffer from the disease. Thank you.